Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS, Bachelor's Degree Programs, Post-Basic Bachelor of Science in Nursing B.Sc.N PB, BNS, 109 Community Health Nursing, Block-1 Principles of Practices of Community Health Nursing, Unit-1 Introduction to Community Health Nursing, 1.0 Objectives. After going through this unit, you should be able to summarize the events involved in the changes and development in community health in India, define various terms such as health, public health, community health and community health nursing, explain the concept of identification and diagnosis of community health. Discuss community health nursing process and describe the knowledge, skill and attitude required to practice community health nursing. 1.1 Introduction. In this unit, you will go through the development of community health in India and worldwide. We shall trace the historical development during various periods before independence of India and in post-independence period. You will also be reviewing various terms commonly used in the course of community health nursing. As you understand an individual's signs and symptoms for identification and diagnosis of his health status, similarly you will learn about the process of identification and diagnosis of a family's health status and community health status. You will also be familiar with the preparation needed for the community health nurse. 1.2 Development of community and community health nursing. We shall trace out the development of community health nursing in the following subsections. 1.2.1 The world global. The historical development from pre-Christian era influenced the medical and nursing practices. Rudiments of community health can be traced from the earliest civilizations. Pre-Christian era, people have always been concerned with the events surrounding birth, death and illness. A new conceptualization of man influenced the health practices. The early church believed that the Roman and Grecian ways pampered the body at the expense of the soul. Disease was viewed as a punishment for sin. The Renaissance ushered in a new period of history during which community health as currently known began. The history of the early Christian church is replete with examples of home health care. Of considerable importance was the work of Saint Vincent de Paul and Mademoiselle Legras, who established what was probably the first actual community health nursing program. The Industrial Revolution witnessed tremendous advances in transportation, communication and other forms of technology. Modern public health efforts began in England, the first modern industrial nation. The Poor Law Amendment Act of 1834 ushered in a new era of social welfare and community health in England. Lillian Ward organized visiting nursing in New York in the 19th century, established the unique program at the Henry Street settlement, and was responsible for many improvements in living conditions in New York City. The first visiting nurse society in America began in Philadelphia in 1886 to provide home health care for the sick. The early 20th century witnessed multiple improvements that both directly and indirectly affected health status. 1.2.2 India. Let us discuss the development of community health under various periods in the history of India. The changes and developments in man's environment and society and the scientific advancement in technology and medicine have affected community medicine and community nursing practice for community health in India. Industrialization and urbanization have compounded the problems in the management of community health. Let us briefly present the historical events in the development of community health in India. Vedic period, 3000 BC to 1400 BC, the Indus Valley civilization showed relics of planned cities and practice of environmental sanitation. The Ayurveda and Siddha system of medicine practiced during the time suggests the development of comprehensive concept of health by the ancient sages of India. May all men be free from disease and may all be healthy was an ancient saying of the Indian sages. The concept of happiness has its roots in the ancient Indian philosophy of life, which conceived the oneness and unity of all people. Wherever they lived, post-Vedic period, 600 BC to 600 AD, medical education was introduced in the ancient universities of Nalanda and Taxila. King Ashoka expanded the hospital system introduced during the Buddhist period, Mughal period, about 1000 AD. The Arabic system of medicine known in India as Unani system was introduced and became part of the Indian medicine, British period, 19th century to mid-20th century. Many acts on health were passed. Significant events during this period gives a brief account of the changes and development in the public health system in India. 1757 The Britishers established their rule in India. 1825 Quarantine Act promulgated. 1859 A Royal Commission was appointed to investigate into the cause of unhealthy conditions prevailing in the British Army stationed in India. 1864 Sanitary Commissioners appointed in Bombay, Madras and Bengal. 1869 Public Health Commissioner and a Statistical Officer were appointed by Government of India. 1873 Birth and Death Registration Act promulgated. 1880 Vaccination Act passed. 1881 First Indian Factories Act passed. First All India Census taken. 1897 Epidemic Act passed. 1904 Plague Commission Recommendation. 1907 Central Research Laboratory at Cosly established. 1911 Indian Council of Medical Research, ICMR, established. 1918 Lady Reading Health School in Delhi established. Nutrition Research Laboratory at Kunur, Tamil Nadu, established. 1919 Decentralization of Health Administration in India. 1921 Legislation introduced for advancement of public health. 1930 All India Institute of Hygiene and Public Health established at Calcutta with aid from Rockefeller Foundation. 1931 Maternal and Child Health Bureau established by Indian Red Cross Society. 1939 Madras Public Health Act passed. Rural health training at Singur near Calcutta started with assistance from Rockefeller Foundation. Indian Tuberculosis Association established. 1940 Drug Act passed. Pre-independence period. 1943 Ghore Committee appointed. 1946 Ghore Committee report submitted. Post-independence period. 1947 Ministries of Health established in Centre State Government. Director General of Health Services and Director of Health Services appointed by Central and State Health Ministers. Indian Nursing Council Act passed. 1948 India joined as a member state of WHO. 1949 ESI Act passed. 1950 Constitution of India came into force. Planning Commission set up in India. 1951 Beginning of first 5-year plan. Central Drug Research Institute at Lucknow established. Central Food Research Institute at Mysore established. Diploma in Community Health Nursing started at College of Nursing, Delhi. 1952 Community Development Program launched on 2nd October. Constitution of Central Council of Health. Primary Health Centers set up. Viral Research Center at Pune established. 1953 National Malaria Control Program started. National Smallpox Eradication Program started. National Family Planning Program started. 1954 Contributory Health Services Scheme initiated. Central Social Welfare Board set up. National Water Supply and Sanitation Scheme started. National Leprosy Control Program started. VDRL antigen production set up in Calcutta. Food Adulteration Act passed. 1955 National Filaria Control Program started. Central Leprosy Training and Research Center at Chingalpet, 1956. Central Health Education Bureau established, Second Five-Year Plan, 1958. National Malaria Eradication Program initiated, 1959. Mudliar Committee appointed, National Tuberculosis Institute at Bangalore, National Research Laboratory at Kunur shifted to Hyderabad, AP, 1960. Constitution of School Health Committee. 1961. Muldaliar Committee Report published, Third Five-Year Plan, 1962. Central Family Planning Institute established, National Smallpox Eradication Program, National Goiter Control Program started, 1963. Applied Nutrition Program launched, National Institute of Communicable Disease inaugurated, National Trachoma Control Program started, Chadda Commission Report submitted, 1964. National Institute of Health Administration Education set up at Delhi, 1965. Mukherjee Committee constituted, 1967. Jungawalla Committee submitted report, Modak Committee set up, Small Family Norm Committee set up, 1969. Fourth Five-Year Plan, 1970. Drug Control Order, All India Hospital Postpartum Program. Population Council of India, 1971. Family Pension Scheme for Industrial Workers came into force, 1972. Medical Termination of Pregnancy Act came into force on 1st April, National Institute of Nutrition set up in Hyderabad, 1973. Kartar Singh Committee submits report, National Program of Minimum Needs incorporated with Health Services, 1974. Fifth Five-Year Plan. 1975. India declared smallpox free in July, ICDS set up in October, ESI Act amended, National Children Welfare Board set up. Srivastava Mitti submits report, 1976. Prevention of Food Adulteration Act amended passed, Indian Factories Act amended, National Program for Preventions of Blindness formulated, 1977. Smallpox declared eradicated in Asia by WHO. National Institute of Health and Family Planning formed, Training of Community Health Workers Rural Health Scheme started, 1978. Alma Ata Declaration of Health for All adopted by India, 1979. World Health Assembly endorsed Declaration of Alma Ata on Primary Health Care, 1980. Sixth Five-Year Plan, 1981. Census taken, Emergence of AIDS. India committed to the goal of providing safe drinking water and adequate sanitation for all by 1990. Prevention and Control of Air Pollution Act introduced, 1982. National Health Policy announced, Guinea Worm Eradication Program launched, 1984. Bhopal Gas Tragedy December, 1985. Seventh Five-Year Plan, Universal Immunization Program launched. Lepers Act 1898 repealed, 1987. National AIDS Control Program started, New 20-Point Program launched, Safe Motherhood Program launched, National Diabetes Control Program started, 1991. Census taken, 1992. Eighth Five-Year Plan, 1994. IGNOU launched Post-Basic B.Sc. Nursing Program, 1995. Pulse Polio Immunization conducted, 1997. Reproductive and Child Health Program implemented, 1998. Ninth Five-Year Plan, 2000. National Population Policy, 2001. Census taken, 2002. National Health Policy 2002, 2003. 10th Five-Year Plan, 2005. National Rural Health Mission launched, 1.3 Concepts of Community Health Nursing. We shall focus on the concept of community health, and community health nursing as follows. 1.3.1 Related to community. Community is a social group determined by geographical boundaries and/or common values and interests. Its members know and interact with each other. It functions within a particular social structure and exhibits and creates certain norms, values and social institutions. The individual belongs to the broader society through his family and community. 1.3.2 Related to community health. Community health refers to the health status of the members of the community, to the problems affecting the health, and to the totality of health care provided for the community. The major determinants of community health are the health status, disease patterns, and health expectations of the people. In addition, the social, economic, and cultural environments influence the health behavior, and health perceptions of the group both positively and negatively. Rapid population growth and urbanization contribute to the health problems. A new concept of public health arose in this century according to which community has a direct responsibility for the health of the individual in the community. A sick person is a community's liability. This led to the concept that healthy people are a nation's greatest human resource for economic development of the country. For this reason, the community should provide facilities to provide comprehensive medical and health care, both promotive and curative, to all its citizens. Community health postulates a unified and balanced integration of promotive, preventive, curative and rehabilitation services. Thus, the term public health is replaced by community health. Since a community has a direct responsibility for the health of every individual, action was directed towards all aspects of health. Health of an individual includes physical, mental, social and spiritual well-being in his natural environment such as family, school or place of work. The assessment of health requires an understanding of the general population to be served. Major categories of information on health are 1. Demographic data, present and projected population according to age, sex, location. Population density, migration, life expectancy, probable birth rate, literacy rates. 2. Environmental characteristics, housing conditions, working conditions, educational opportunities, sources of water supply, water duality, waste water disposal and water pollution control, solid waste management, including sanitary handling and disposal, vector control and the control of alternative hosts of diseases, environmental pollution, climate, structural organization and administration of environmental health services. 3. Economic information, occupational characteristics, patterns and tendencies regarding personal or family income, health sector income and expenditure, national income and expenditure. Cost of providing health services and of maintaining the different categories of health manpower, cost-effect information for selected health problems. 4. Health needs, mortality and morbidity data according to major causes, age, sex, geographic distribution, the extent to which the principal diagnostic categories result in a demand for health care and in disability. 5. Utilization of health care services by the population. Health services actually utilized, number, types, quality, effects. Characteristics of those who use services, including their attitudes and knowledge regarding the use of health services and the health system that provide them, unmet demands or needs for health services. Approximate volume of services desired that are not obtained, according to type of service, characteristics of those who desire services, reasons for not obtaining the desired services. 1.3.3 Related to community health nursing. Community health nursing combines nursing and public health. It synthesizes the body of knowledge from the public health sciences and professional nursing theories. The purpose of this synthesis is to improve the health of the entire community. Thus, community health nursing can be defined as a field of practice that synthesizes knowledge and skills in nursing, public health, and applies them toward the promotion of optimal health for the total community. Community health nursing as practiced today is a product of growth and adaptation. it has been amended to accommodate the needs of a changing society. Many factors have influenced the growth of community health nursing. 5 significant forces that continue to shape the development of community health nursing are advanced technology, progress in casual thinking, changes in education, the changing role of the nurse, and the consumer movement. Trends in community health nursing are times chronic diseases and prolonged hospitalization, times problems of the aged, times population explosion and family planning, times pollution, noise and radiation, times industrialization and urbanization, times addiction to drugs and alcohol. Health education, concepts of sociology, psychology, anthropology and mental health, times introduction and use of gobar gas plant, Anganwadi, vocational courses and use of media, vital statistics, assessment and recording, adulteration of drugs and food. Characteristics of community health nursing. 6 characteristics of community health nursing are: 1. It is a field of nursing. Community health nursing is a field of nursing. Its basic knowledge and skills are those of professional nursing practice. It seeks to give humanistic, accessible and holistic care. Community health nursing is a nursing specialty. Nursing theory forms its foundation and the nursing process is one of its basic tools, and community health nursing adds concepts, knowledge and skills from other disciplines to become a distinctive practice. 2. It combines public health with nursing. Community health nursing incorporates public health content. Knowledge of the elements essential to community health are history, philosophy of public health, concepts of aggregates, priority of preventive and health promotive strategies, concepts of epidemiology and its methods, influence of environmental factors on health, principles underlying management and organization of community health, and public health policy analysis and development. 3. It is population-oriented. The central mission of community health practice is to improve the health of the population groups. Community health nursing shares the essential features. It is population-oriented, concerned with the personal and environmental health of the population groups. The population-oriented focus requires the observation of relationships. 4. It emphasizes health. Community health nursing emphasizes on positive health or wellness. Community health nursing has the primary charge to prevent health problems from occurring and to promote a higher level of health. Community health nurses concentrate on the wellness end of the wellness-illness continuum in a variety of ways. Community health nurses seek out potential health problems. They identify high-risk groups and institute preventive programs. A wellness emphasis requires taking initiative and making sound judgments. 5. It involves interdisciplinary collaboration. Community health nurses work as full members of the health care team. Coordination and cooperation are required in practice that deals with the population groups. Effective collaboration requires team members who are strong individuals. Community health nurses who think and act independently make a great contribution to the team effort. 6. It promotes client participation. Consumer participation in health care is an important characteristic of community health nursing. Community health nurses encourage consumer participation by promoting clients' sense of responsibility for their own health. This process is known as self-care. Consumer participation is promoted when clients are treated as partners on the healthcare team. The goal is collaborating with clients rather than working for clients. Conceptual framework for community health nursing practice. Conceptual framework for community health nursing include 5 sets of variables. Times practice priorities are prevention, protection and promotion. Times interventions are education, engineering and enforcement. Times scope of practice encompasses the range from individual to aggregates. Times 4 health determinants are factors to be considered in designing practice. Interventions. They are human biological determinants, environmental determinants, medical technological organizational determinants and social behavioral determinants, community health nursing dynamics with two essential dynamics, the nursing process and the valuing process. 1.4 Community identification and community diagnosis. In this section we shall discuss about community diagnosis and identification as given below. 1.4.1 Community identification. Community identification is a systematic process of knowing and exploring a defined community for assessing its health status and determining the possible factors affecting the health of people. It is more than making a medical or nursing diagnosis relevant to the community. It implies getting to know the area where the community is living, the other families in the area, the community leaders in particular, their lifestyle and their resources. All these information can be obtained by holding formal and informal meeting with community people, leaders and organized group which may include panchayat members, school teachers, mahila mandals, youth clubs groups, young innovators etc. 2. Observation visit to community for observation of physical environment, biological environment and psychosocial environment. 3. Informal conversation with people. 4. Going through records. Formal community sample surveys. 6. Discussions with health and allied health personnel working in the community. Community assessment tools which are present with the agency or the community health center can be used to collect valid information about the community. The community identification will also help in making community diagnosis. Community identification is to systematically gather health-related data about a selected community, develop community profile, explore boundaries of community, identify health and health-related resources in the community, identify community assets and liabilities, examine relationship between data gathered to the health and well-being of the community and record the health conditions that are threats to a specific population groups in the community, identify biological, physical and social forces that have bearing on the health of the community. Indications for community identification are times to become acquainted with a given community for the purpose of assessment. Times community identification provides data for nursing action. Times needs assessment of a specific community. 1.4.2 Community diagnosis. This will highlight the health problems and the health needs of the community, which you will be able to assess from the information. Assessment of the health status will be with reference to the people, their environment, their lifestyle, available resources. Family diagnosis may include problems and needs of different age group of people, illiteracy and poverty, high infant and maternal mortality, high fertility, high morbidity, prevalence of risk factors, poor environmental sanitation, poor personal hygiene and health habits or traditional cultural practices. Lack of health knowledge and attitude, inadequate and inefficient resources available subsequent to making the community diagnosis. The health problems or needs are prioritized for planning and implementing comprehensive health action. Community health action is the sum total of various health and health-related activities which are decided to deal with the health problems and health needs, keeping in mind the resources, wishes of the family, nature of the problem, their impact on the health of the people at large, and the agency's policies and objectives. These services include safe motherhood services, child survival services, nutrition and family welfare services, prevention and control of local communicable diseases, environmental sanitation, health education, etc. Community diagnosis is the cornerstone of community health practice. Various assessments and procedures are undertaken before a diagnosis is made. Similarly, before implementation of the health activities in a given community, it is important to assess the situation in the community, its problems, its needs, resources as well as its traditions, history, etc. Only with this knowledge appropriate measures would be undertaken in the delivery of health care. Community diagnosis is the first step in the establishment of a health program. Steps in planning program are community diagnosis, identification of problems, needs and resources, establishment of priorities, definition of objectives for action, establishment of a plan of action, choice of activities, mobilization and coordination of resources, evaluation, different stages in community diagnosis. To come to the conclusion of the community diagnosis, a community health nurse needs to have general knowledge of the community which is necessary for all community activities. And along with the general knowledge we need to have specific knowledge. Stage I involves the identification of the factors which may influence community health. Includes knowledge related to concerned program. Stage 2 identification and classification of data which includes quantitative and qualitative data. Stage 3 involves data collecting, i.e., source of data and methodology of collection. 1.5 Community health nursing process. Nursing process is a problem-solving process and helps in providing systematic need-based care to the client in hospital and community setting. Community health nursing is concerned with helping people to solve their health problems which may be simple like dealing with minor ailments or complex like control of communicable diseases. The problems may be dealt with at individual level, family level, village level, block or district level. This can be done by deliberated systematic series of steps which helps to solve the problems and achieve desired goals of health promotion. Prevention and control of health problems. Community health nursing process is a systematic approach to nursing practice in an interacting, interrelated and interdependent psychic phenomenon of assessment, planning, intervention and evaluation termed as components of nursing process which is interchanged to assist the client in a collaborative manner. The aim is to restore a continuum of balance and powerful direction within the internal environment. 3 characteristics emphasize the importance of this tool for community health nursing. First, the nursing process is a problem-solving process that addresses the community health problems at all aggregate levels and aims to prevent illness and to promote community health. Second, it is a management process that requires analysis of a situation, decision-making, planning, organizing, directing and controlling service efforts and evaluating outcomes. As a management tool, the nursing process addresses all aggregate levels. Third, it is a change process that works to improve various levels of health-related systems and the way people behave within those systems. The process has 5 major steps. I. Establishing and maintaining a working relationship. 2. Assessing the health and nursing situation. 2. Establishing the goals for health and nursing care. 4. Constructing and implementing a program of action. V. Evaluating the action. These steps may also be categorized into 3 different phases. I. The assessment phase. 2. The intervention phase. 3. The evaluation phase. These phases are sequential, progress from one phase to another, i.e., the assessment of problems help in formulation of goals and objectives, actions to be implemented followed by evaluation to measure the outcomes of the intervention. I. Establishing and maintaining working relationship. Community health nursing process is working with the people, helping them to solve their problems, develop their competencies, to meet their own health needs. This is possible only by establishing working relationship with the family and community. Basic to this kind of relationship is an attitude of trust and confidence in the integrity and capabilities of each partner in health to improve the client's health status. A working relationship permits the nurse and the client to know each other and work together, have two-way communication, discuss the problem and find solution to improve health conditions or situation, i.e., productivity. It promotes acceptance by the client, mutual trust. Working relationship is developed by knowing the client and by communicating the intentions to help and the nature of assistance that can be extended. Be a good listener, communication, show desire to help, answer their queries, consider their views, meet their immediate needs, appreciates what is worthwhile, confidence, motivate to bring change in health behavior, be empathetic, empathy. 2. Assessing the health and nursing situation. Assessment of health and nursing situation is essential as it will help to determine the extent and nature of problems and the underlying causes and the resources available to deal with the health and nursing problems. It involves collection and analysis of initial data, factual information about the following aspects as also described with community identification. A. Human biology, demographic characteristics like age, sex, social economic conditions, deaths, births, mental status, hereditary characteristics. B. Lifestyle and cultural patterns, customs. C. Environment, physical, biological, social, and spiritual. D. Resources, health and health-allied resources. The methods used for data collection are the same as for community identification, and they are questioning, observation and record analysis. The tools to collect data are interview, questionnaire, observation checklist. A nurse may walk through the area to get to observe the overall status of the community and their living standards. She meets the village leaders to know their lifestyle, health problems, various assets, and liabilities. The coping ability of the family can be assessed from family folders and individual records and by actually working with the family. This information will help to identify health deficits, aid any disease, health threats, i.e., any situation which may cause any disease, example, poor environmental situation, foreseeable crisis situation, example, adolescence, old age, menopause, etc., and coping abilities to deal with problems, example, knowledge, attitude, lifestyle, etc. Once the problems are identified, it is better to prioritize these problems because all problems cannot be dealt with at once. 4 major criteria have been selected to consider the priority of problems: nature of problem, its gravity, prognosis and impact on the health of others, whether the problem can be minimized, controlled or eradicated, i.e., whether something useful can be done for the problem, whether the problem can be prevented or not, family's community's perception of the problem and its need, i.e., whether the family community considers it a serious problem requiring immediate care, whether it is considered as a felt problem, felt need by the family community. After identification of the problem, use the above criteria to prioritize the problems. Ensure the understanding and acceptance of these problems and health needs by the community and families. This can be done by establishing contacts and discussing and explaining the actual findings to them, answering their queries and doubts, and relating health need to overall family developmental goals, etc. Thus, you can help them solve one problem at a time. 2. Establishing goals for health and nursing care. Establishing goals is the third step of the nursing process. A goal is a broad statement of directions to resolve the situation identified while assessing the health and nursing situation. It is very important to set the goals because goals not only give directions to selection of actions but also help in sustaining and evaluating the actions planned and implemented. They also help the client to judge whether the individual, family and community know what to do. The goals should be clearly stated, specific, measurable and time-related. Example, to to ensure comprehensive maternal care to all mothers in a particular village by trained health personnel in order to bring down IMR from 162 per 1000 live birth to 80 by 1000 live births during period of 5 years. This is a very general goal. This goal includes 3 sub-area, i.e., antenatal, natal and postnatal goals. The specific goals, which are explicit statements relevant to these 3 sub-areas of the goal, need to be identified. For antenatal care, the goal may include, for that village, to register all antenatal mothers of 12 to 16 weeks of pregnancy, to get medical examination of all mothers done once in each trimester, to arrange for periodical checkup, to prevent anemia by prophylaxis treatment, to immunize against tetanus, to educate the mothers on various aspects of antenatal care, to identify high-risk mothers and arrange for referral services, etc., to prepare for confinements at home, to train traditional birth attendants, TBA. These specific goals objectives determine the actual actions to be planned and implemented which will help resolve the situation and achieve the targets. Like that, there can be a number of general goals objectives and the specific objectives. The general goal with its specific objectives is at the level of community. Similar goal with its specific objectives can be stated at the individuals and family level, e.g., ensure safe and effective maternal care to the pregnant mother by the trained health personnel so as to have a live healthy baby and to promote and maintain the health of mother and baby, to develop a family's awareness and competence to deal with the special need of the mother during antenatal period, natal period and postnatal period so as to promote and maintain the health of both mother and the baby. Specific objectives will be the same as listed earlier. After the general and specific goals are established, they should be reviewed to determine which are to be achieved immediately or within a limited period of time, i.e., the short-term goals, example, preparation for component which are to be achieved in the future, i.e., long-term goals determining ways for decreasing expenditure and increasing income. This will permit the health worker and the client to concentrate on those goals which help in meeting the immediate needs and movement towards achieving of the final goal. All these goals and objectives are meant for clients and therefore should be determined by a joint effort of the nurse and the client. This will promote client's compliance with the actions to be planned and implemented. Above all, the goals and specific objectives should be realistic and achievable, otherwise it would lead to disappointments and conflicts. 4. Constructing and implementing program of actions. This phase refers to identification of appropriate nursing interventions, developing an intervention. For any single objective to be achieved, there will be several suitable alternative actions and we have to choose those which are appropriate and feasible in achieving the objectives. We can take the example of specific objectives listed in the previous step, i.e., to register all antenatal mothers by 12 to 16 weeks of pregnancy, to get medical examinations of all mothers who are at risk. Alternative actions for objectives I could be A. Registration in home, registration in the clinic or both, B. Registration by indigenous trained midwife, ANM or by any one of them who is responsible for registration, C. What care to be included at the time of registration. Similarly, there can be several alternative actions for objectives, 2. In terms of day, time, location and what care to be included. Similarly, we can take another example of providing care to the disabled arthritis patient or tuberculosis patient. The care can be given at home, in the nursing home hospital, in day care center, etc. All these actions have pros and cons, which need to be thoroughly considered along with the family, and the one which is most suitable to the family situations should be implemented. The criteria which can help choose alternative actions are I. Agency policy, 2. Family resources. 3. Community resources. 4. Nursing personnel available, etc. For each of the above mentioned actions to be implemented, there are 3 types of nursing interventions: A. Supplemental. B. Facilitative. C. Development. In supplemental nursing intervention, the nurse gives the care which the family cannot do, but at the same time the nurse helps family to develop the abilities to give the care through education, which is developmental intervention. She also helps families in mobilizing and developing resources which are required to give care. This type of intervention is facilitative. Most of the times all the 3 types of interventions are implemented. Of course, any one of these may predominate depending upon the situation themselves, and the nurses provide direct care whether by themselves or through the auxiliary nurses. Example: care of the sick individual, antenatal mothers, postnatal mothers, etc. But at the same time, she educates the mothers and other members of the family to learn to take care of the sick, newborn babies, postnatal mothers, etc., and give care in her absence. She also helps families develop their own resources and mobilize resources available to the community which will help in implementing the actions planned. The nurse need to know the functional relation of these resources, which include health and health-allied agencies. You are expected to identify these resources, make a list of these, and visit these agencies to know their functions and procedure of functioning, governmental or non-governmental. During your field experience, you are expected to identify these resources, make a list of these, and visit these agencies to know their functions and procedure of functioning. In community health, varied health problem and health needs are identified. For each of the health problem and need, there will be alternative actions. Example: health threats like poor environmental sanitation, defective health behaviors, health deficits like various communicable and chronic diseases, and various interventions. She also helps families in mobilizing and developing resources which are required to give care. This type of intervention is facilitative. Most of the times all the 3 types of interventions are implemented. Of course, any one of these may predominate depending upon the situation themselves, and the nurse provides direct care whether by themselves or through the auxiliary nurses. Example: care of the sick individual, antenatal mothers, postnatal mothers, etc. But at the same time, she educates the mothers and other members of the family to learn to take care of the sick, newborn babies, postnatal mothers, etc., and give care in her absence. She also helps families develop their own resources and mobilize resources available to the community which will help in implementing the actions planned. The nurse need to know the functional relation of these resources, which include health and health-allied agencies, but you are expected to identify these resources, make a list of these, and visit these agencies to know their functions and procedure of functioning, governmental or non-governmental. During your field experience, you are expected to identify these resources, make a list of these, and visit these agencies to know their functions and procedure of functioning. In community health, varied health problems and health needs are identified. For each of the health problem and need, there will be alternative actions. Example: health threats like poor environmental sanitation, defective health behaviors. Health deficits like various communicable and chronic diseases and various crisis situations, etc., which require nursing intervention. It is very important to develop an organized schedule, i.e., when to do what and who will deal with the problems. This implies prioritizing and phasing out problems and the actions to deal with these problems as all problems that cannot be dealt with simultaneously. Prioritizing implies that there are some problems and health situations which require immediate intervention, example, communicable diseases, malaria, etc., which can be prevented by simple measures, high-risk groups like mothers and children and the elderly groups. Phasing implies dealing of problem into manageable units or stages. Evaluating the action plan. Evaluation of community health nursing services determines the effectiveness of services provided, i.e., whether the intended results are achieved or not specified. It also helps to identify the causes of failure which can be rectified. Evidence of effectiveness are change in knowledge, attitudes and practice, degree of independence, reduction in morbidity and mortality rates, decrease in birth rates, increase in life expectancy, population coverage, clinic attendance. It shows evaluation is qualitative and quantitative. It is very important to have a. Well-defined measurable objectives, b. Baseline data to start with, c. Maintain accurate record of services rendered. D. Observe changes in health behavior, e. Analyze, and f. Interpret the data to determine the effectiveness of services. 1.6 Principles of Community Health Nursing. The community health nurse occupies a key place in the health team. The process to deal with health problems in the community remains constant. Principle is an accepted truth, the evidence for which might be scientific. The community health nurse's role in her community work makes her a teacher, counselor, friend, a midwife, a social worker, a nutritionist, a nurse practitioner, a health educator, leading her to perform several tasks. The community health nurse working in the community should follow the following principles in her daily work regardless of her special training or position. Principles of community health nursing practice are: a. A community health nurse should know the community thoroughly, i.e., community leaders, school teachers, women leaders. This will help to establish good working relationship. The work of the community health nurse is family-centered, with the home being the usual setting. The nurse is the guest and the family patient is the host. The illness of one member of the family affects the whole family. The community health nurse is able to observe the anxiety, fear and behavior of each family member in the house more closely, and she can decide the health action appropriately and utilize the community resources. The nurse's ultimate goal is to make the entire family independent and knowledgeable regarding health principles and practices. Nurse has to plan with the family and not for the family. Emphasis is on health promotion for all family members through health counseling, emotional support and understanding, teaching, demonstrating and providing nursing care to the patient. B. The community health nurse should work effectively with other members of the health team by establishing good interpersonal relationship. She should be aware of the role of various health team members to avoid duplication of services. Health team members in community health are doctors, community health nurse, multipurpose health worker male and female, lady health visitor, traditional birth attendant, village guide, etc. The team plans and executes health programs. The community health nurse should assist in planning, implementation and evaluation of the programs. The community health nurse works with the family as a unit of service and bring into each home special services required for sanitation, nutritional, maternal and child health problems and family welfare or control of communicable diseases or immunization. She needs medical support for her work. She solves the problem of environmental sanitation by coordinating with sanitarian, and he can also refer problems to her which fall within her jurisdiction. She supervises the work of multipurpose health assistant and health worker. She guides them and avoids duplication and repetition of services. Team members have to support each other's work to get the results. C. The community health nurse is responsible to the authorized agency through which she is employed. Nurse employed by the agency, which may be a state, municipality, local bodies, voluntary or private. She has to work in close consultation with the employing authority and work within their laid down policies. If she is working as District Public Health Nursing Officer, then Chief Medical Officer of the district is authority for reporting, who is responsible for coordination of local program of the district. D. Community health nurse needs to maintain professional relationship and etiquette with everyone in the community. She needs to be conversant with the local customs and should live more or less with the people whom she serves. It becomes mandatory for a nurse to develop professional relationship with other organizations concerned with health in her area. She needs to visit offices of Block Development Officer, Child Development Project Officer, Panchayat, Mahila Mandals, voluntary community organizations and local days. The nurse should work with Hakims, Vaids, homeopathic and allopathic medical practitioners. She needs to explain her program of work to get cooperation from all, especially develop friendly relationship with the Dai in whom the village people have faith. Local health practitioners can become hindrance for starting a new program. So to get their support, nurse needs to orient them for getting community's cooperation. Community health nursing services should be available to all people irrespective of their age, sex, creed, nationality, religion, political affiliation, socioeconomic status. Every human being has a right to good personal health and environment conducive to healthy living. So community health nursing services must be available to all persons according to their health needs. F. The community health nurse should be non-sectarian, non-political in her relationship. She should not interfere with the religious and political beliefs of people. This will help the community in accepting the community health nurse. A community health nurse would not interfere in the affairs of persons' political or religious beliefs. Understanding of various religious beliefs, culture, and customs of community can help her to render better services. People should feel that she accepts them as they are, then they will listen attentively and accept her teaching. A community health nurse should also be careful not to thrust her religious beliefs on the family. G. She needs to be vigilant in not accepting any bribes or gifts. According to the policy of the employing authority, the nurse has to charge fees in certain cases, but she must give official receipts and deposit the fees in the concerned office as soon as possible. She should not take anything for her personal use such as gifts or money. H. Health services should be based on felt needs. Health programs should be planned on the felt need of the people. Needs can be assessed by health survey to enable the nurse to be familiar with the prevailing health problems and health resources. Nurses should concentrate on the urgent health problems using the more efficient methods available. I. The services offered need to be realistic in terms of available manpower and facilities and be of continuous nature. The services planned should be according to the needs of the clients and the community. Before planning the health services, the money, material and manpower needs to be assessed. J. Health education needs to be interwoven throughout the practice. She should plan community health education programs. Health teaching is an integral part of every health program. Teaching is a therapeutic tool for the nurse, which is cheap, permanent, and all nurses can use it. Many health problems can be solved by effective health teaching. Teaching is to be imparted to individual as well as to group. Teaching must be well planned according to the need and scientifically correct and of practical value to change habits for healthy living. K. Continuous service is effective service. Health services should be provided continuously to the individual family and the nurse must have repeated contact with them. With repeated contact, people can get to know and trust the health worker. Careful follow-up is necessary to see the effectiveness of therapy and whether teaching has been put into practice to improve health habits. The services offered by the community health nurse needs to be periodically assessed to determine the progress. The criteria for evaluation should be built in the plan to meet the objectives, which should be clearly stated. Evaluation helps to critically review program and guide future planning. Adequate reports and records need to be maintained on the work and services carried out by the community health nurse. The maintenance of accurate records and reports help in their use to both family and agency. The family record is indispensable to the nurse in her daily work. It is also an important element in providing continuity of nursing care. Good recording cover all nurse family and the nurse-patient contacts and interaction. The community health nurse uses patient and family records in planning for home visits and care of the patient. Before first visit to the family, the community health nurse goes through the records to get acquainted with the family. Periodical critical study of records and reports help the agency top leadership to evaluate its program and determine current and long-term objectives. The records are a source of statistical information. These are valuable in ascertaining needs for additional staff and planning budget. Records provide guidance in making staff assignments. The community health nurse is responsible for maintaining records which are current, accurate, complete and legible. The community health nurse needs to be well qualified and should maintain professional interest. The community health nurse is herself responsible for her professional growth and education. Continuing education is considered a lifelong activity in all fields to be the greatest single challenge to health professional personnel. Each nurse needs to establish her own immediate and long-term goals in order to continue building and developing her education, both professional and general. A community health nurse can do it by reading journals and periodicals on nursing and allied subjects, by attending and participating in the meeting of her professional organization, by attending lectures in the humanities and arts. The community health nurse should plan to join courses in the colleges and universities for higher education whenever possible. 6. Facilities must be provided in any agency for professional growth. The community health nurse should attend ongoing staff education programs. An in-service education program is essential for the attainment of efficiency and for the professional growth. Provision should be made for in-service training and refresher course. Promising nurses should be encouraged to join advanced studies. Periodic planned staff meetings for sharing experiences and information with other members of the health team also provide an opportunity for widening professional knowledge and skills. Attending conferences, professional meetings in the states and national level also help to broaden knowledge. The community health nurse needs to have job satisfaction. There should be provision for supervision and directing community health nursing services. The aim of supervision is to develop the abilities and skills of the community health nurse. Supervision in the community health agencies by qualified nurse is essential for continuous improvement of nursing services to patient and family. It helps in the planning of nursing work and for coordination of their activities with the agency. The methods used in supervision are planned and continuous staff orientation, review of family case records by supervisor and nurse, supervised home visits, individual and group conferences related to nurses' work. An adequate and satisfactory program of supervision by fully prepared community health nurse assists in the growth and development of each staff member and continuous improvement of the nursing service to the community. 9. the community health nurse needs to practice herself what she teaches. 1.7 Preparation and functions of community health nurse. We shall discuss about preparation roles and functions of community health NURSE in following subsections. 1.7.1 Educational requirement. A. Community health nurse prepared in General Nursing Diploma Degree Program with Integrated Community Health Nursing course or who has done certificate course in Public Health Nursing can work in the hospital as well as the community. The community health nurse should hold a registration certificate as a nurse and as a midwife from the State Registration Nursing Council. In the hospital, the nurse works with sick patients, but the community health nurse has to deal with healthy families and sick persons in the homes and their families. She also has to work with teachers and school children or industrial workers, elderly grandparents within the social and cultural situations. She is expected to solve the problems of the community such as clean, healthy environment, safe water supply and prevention and control of communicable diseases. She has to give health education to people to develop healthy habits. So she needs to be well versed in social sciences and humanities. The methods and techniques of epidemiology. Most of the time community health nurse is placed in such a situation that she has to take independent decisions. So in addition to the knowledge of theory and practice of nursing, other competencies of management and leadership are also required in community health nursing to meet the needs of patients, family and community. Most of the time she would be working where there is no doctor. 1.7.2 Competence required. A community health nurse needs to have abilities and skills in communication, interviewing, listening, teaching and sharing of pertinent information with professional colleagues, observational skill, ability to note signs and symptoms of physical, mental and emotional state in health and disease conditions of patients and their families, knowledge of community resources, expertise for understanding of human behavior in a particular situation, ability to take decision independently. 1.7.3 Scope. The community health nurse has a varied scope and can function in various positions and situations as given below. She can work as a primary care provider, times perform expanded role, times work as a practitioner, family nurse, times home health services, times teacher, educator, times counselor, times researcher, times work, health settings agencies. 1.7.4 Role and functions. School health nurse, occupational health nurse, pediatric nurse. A community health nurse is a qualified person who has undergone basic nursing course with the integration of community health nursing and registered with State Nursing Council. The personal characteristics of a community health nurse are good judgment, interest, ability to work with people, initiative, resourcefulness, sound physical health, ability to establish good IPR, emotional stability, patience, good listening ability. Aspects of a community health nurse. C. Consultant. O. Organizer. M. Main member of the health team. M. Manager. U. Utilizer of manpower. N. Nurse practitioner. I. Independent role. T. Teacher. Y. Yielder. H. Helping client to achieve positive health. E. Encouraging to practice healthy habits. A. Adequate provision of preventive and curative care. L. Leading to progression of health care. T. Teaching IC. H. Helping in crisis intervention. N. Nobility. U. Unselfishness. R. Responsibility. S. Sympathy. E. Efficiency. Role of a community health nurse. Community health nursing incorporates a variety of roles. Several factors influence the roles played by the community health nurses. The organization with which the nurse is affiliated usually has policies that govern nursing activity. Consumers use community health nursing services differently depending on their perception of nursing. 7 major roles have been identified. A. Care provider. As a care provider, she has to ensure is the basic services provided times target of service if for LEC times assessing collective needs and give services. C. Holistic care is provided. Ensure that the focus is on wellness. Necessary skills as a care provider required are observation, listening, communication and counseling. B. Educator. Health teaching is a part of good nursing care and one of three major functions of the community health nurse. Health education provides health information and health consciousness. Community health nurse educates people beyond the scope of routine educational activity. As an educator, community health nurse has to times facilitate clients' learning, times share information, times act as a consultant, times hold formal classes, times utilize groups for teaching, times use expertise referrals. Facilitate clients' self-education, times emphasize illness, prevention and health promotion. C. Advocate patients' right to receive just, equal and human treatment. The goal is to help client gain greater independence and make the system more responsive and relevant to the needs of the client. As an advocate, the community health nurse pleads the cause of another by speaking and acting on others' behalf. Clients need someone to guide them through the complexities of the system and to assume the satisfaction of their need. Advocate roles require four important characteristics. Times D. Manager, assertiveness, willingness to take risk, ability to communicate well, to bargain thoroughly convincingly, ability to identify sources of power and tap them for clients' benefit. Community health nurses are managers of health care. It involves activities like supervising care, managing caseload, administering clinic, conducting a community health planning project, etc. The main functions as a manager include planning. It is the basic function which enables to decide objectives and achieve objectives and time required for planning. She has to determine client concern and needs, establish objectives, decide appropriate course of action. Organizing. It includes times identify and structure the activities of an organization, placing people to achieve objectives, arrange matters to accomplish goals. Nurse provides framework in various aspects of service. Framework is part of service preparation, coordinating. It involves bringing people and activities together so that they function harmoniously and achieve desired objectives. It is a complex activity at community level, leading, staffing, supervising, motivating, controlling service activities. E. Collaborator. This involves other members. Community health nurse should work jointly in common endeavor and cooperate with partners of health care. Times successful community health nursing practice depends on collegiality. Times every member of the health team has unique contribution. Times it requires skill in communication, interpreting nurses' contribution, acting assertively. Leader. Community health nurse may also involve functioning as a consultant. Community health nurse remains an active leader. Community health nurse assumes leadership role by guiding decision-making, stimulate interest in health promotion, initiate therapy, direct preventive program. Influence health policy. It is a role of influence and persuasion. It affects changes, and community health nurse is a change agent. Leader role assumes different form in different situation. Community health nurse exerts influence through health planning. Need for coordinated, accessible, cost-effective health care services creates a challenge. G. Researcher. Research is an integral part of community health nursing practice. Attributes required are questioning attitude, careful observation, open-mindedness, times analytic skill, tenacity. Research can be done at different levels. Functions of the community health nurse. Community health nurse functions according to the designation under which she is employed, which would be in accordance with her education and experience. She plays the role of an administrator, Supervisor, teacher, counselor and practitioner. Function I. Provide and promote comprehensive nursing care activity. Assume direct responsibility for providing care, supervise and direct others to do so. Teaching others, organize volunteers, regular staff, referring to other source for care. Function 2. The community health nurse uses nursing as a channel for strengthening family life and promoting personal development and self-realization activity, using opportunities to be with the families in their family functions to learn the customs and traditions of the community. Times involving herself in the functions of the society, social gathering to assess how community as a whole functions, which will help her promoting the social life of the people, using opportunities by participating in the panchayat meetings and conveying the health messages of the time. Function 3. The community health nurse participates in disease control activities through general preventive measures, early identification of disease, provision of care and supervision of care to reduce effects of disease activity, using channels to alert parents, teachers, patients, vulnerable group etc. to symptoms that merit further investigation, preventing intervention, use of family and patient history as a tool for eliciting symptoms, impairment and health risk. Times participating in epidemiological alert and investigation. Participating in screening. Function 4. The community health nurse works with appropriate person in special setting to plan, implement health programs activity, reviewing and interpreting data relevant to health needs of special population groups, arranging with appropriate administrative personnel for schedule and procedures for reporting and evaluating going and special health activities. Function 5. Serving as a member of committees for health planning and actions. The community health nurse plans and evaluates nursing services for the population groups under her care to maximize benefits of nursing care and to bring the nursing effort into proper relationship with that of other health workers serving the same population activity. Identify service development and demographic and vital statistics trends that might have relevance for nursing, setting goals and clearly defined outcomes for nursing service, and establishing a systematic method for checking progress, conferring and planning with other health workers for the care of families and groups, working with nursing supervisor administrator to evaluate nursing accomplishments and to plan for improvement. Function 6. The community health nurse contributes to decision and policy setting in the agency and community activity, sending reports, suggestions based on field observation or other personal experience, accepting membership of agency or community planning agency. Function 7. The community health nurse contributes to the extension of knowledge in nursing and health care by engaging in surveys, studies, and research activity, planning and carrying out sample surveys or studies as part of continuing service effort, participating in research done by others when it is appropriate. However, community health nurses working at the primary health center in staff position have following main functions. A. Identification of community. This includes study of geographical aspects, demographic aspects, environmental aspects, sociocultural aspects and health facilities and resource facilities etc. Identify the health needs and resources and interpret these to the people and to the agency, estimates the required services in her area in relation to her load of work. B. Planning. Community health nurse plans for preparing comprehensive nursing care to individual, family and the community of her areas, plans with the medical officer and with other members of the health team and other related sectors for appropriate care to the family, plans for services in the schools, clinics and health centers, plans for health educational programs and conducts meetings. C. Implementation. Community health nurse gives direct care to patients and families in the homes and in the community with the active participation of the people. She serves, assists doctors with the early diagnosis and carries out their recommendations such as giving injections, doing dressings, explains and utilizes the available resources in the homes and thus gives adequate care adapted to home situations, guides the family in giving care to the sick and supervises the care rendered. This will help the family and community to be self-reliant and responsible for maintaining good health, gives health teaching and counsels the family appropriately. Analysis and guides the families on matters of upkeep of environmental sanitation, nutrition, personal hygiene, makes referrals to appropriate agencies when required, maintain adequate records of families and the care given, collects the vital statistics of her area, integrates health education in all her services, supervises and guides health assistants, health workers, days and health guides, trains local traditional birth attendants, TBA. D. Evaluation, nurse analyzes her own performance periodically, making monthly reports of her area, evaluates the clinic services by going through attendance registers, number of new visits, revisits and the number of immunization completed and motivation of eligible couples for family planning. E. Participation in surveys and conducting research program. Community health nursing is a challenging work and is different from hospital setup. A community health nurse works in the community in their natural environment. She needs to be well-oriented and knowledgeable to handle different situations. 1.8 Summary. We have seen that community health nursing services are for the welfare of the total community. The terms used in community health nursing are defined, starting from health, which is a state of complete physical, mental and social well-being. Public health is for prevention of disease and promotion of health. But in community health, the emphasis that the community health nurse is responsible to provide preventive, promotive, curative and rehabilitative services for each individual. Community health nursing services are provided within the framework of total health efforts. These practices are for preserving and promoting the health of the total population. So, nursing is directed to individual, family and community. Community health nursing process is a continuous process of assessing, planning, implementing and evaluation of the programs. The process helps on developing working relationship with the family to assess their health needs. Community identification helps to assess the needs of the community related to healthy living. You make a community diagnosis and plan for action, such as improvement of water supply, universal immunization, control of communicable diseases and health education, etc. The action taken may be called community treatment. Nurses employed in community health services has to be specially prepared along with nursing, medicine, in social and behavioral sciences and epidemiology. Her area of work is outside the hospital and is vast. She has to make independent decisions. Her role is administrator, supervisor, teacher, counselor, and practitioner. Her functions are assessing, identifying the health needs and resources and plan the health services. In implementation of care, health education is given priority over curative treatment. Evaluation is done periodically to achieve the set goals. The principles of community health nursing are guidelines to be followed in any situation with sound judgment and common sense. Most of these principles pertains to nursing in general, not to community health nursing alone. The responsibilities of community health nurse is to help individual, family and community to develop and utilize their potential for healthful living and to provide nursing care for sick and disabled in their homes. The nurse carries out responsibilities of home visit to patients, families and community groups such as school children, teachers, parents, antenatal and postnatal mothers, industrial workers and elderly, following the laid-down principles. Community health nursing must be based on an understanding and appreciation of needs. Social relationship, culture norms, customs and traditions of patient, family and community. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.